there is a concern, obviously, that it's going to go from the East Coast out here more. We have some cases here where it's turned up. Do you think that it needs to be tested more? Does xylazine need to be tested or need to be checked here? I guess I'm asking for an example of, did it take a while for you guys to realize what you were dealing with there when you started seeing all the wounds and the different issues?
So we actually worked really closely with some other organizations, and I will say that the Philadelphia Department of Health was on top of testing the drug supply. The most important thing for us was knowing what the main adulterants were in our supply. And after we figured that out with the xylazine, we started responding as best as we could. We still have not begun testing humans in urgent cares, hospitals, or treatment facilities, which needs to begin happening immediately. The main drug now is xylazine, with the adulterant being fentanyl. So we need to update withdrawal protocols. And the way that the medical world works, we need to be doing human testing, not just the drug supply.
When you go out into the streets and you're helping people, you don't just bring Narcan, because that won't save them alone, will it? What special equipment are you bringing with you now when you run across this?
So Savage Sisters last year, 2 years ago, began carrying oxygen tanks because the Narcan works on whatever part is an opiate within the drug supply. However, the main supply is now xylazine, which causes respiratory depression. And we were doing rescue breathing for upwards of 16 minutes. And the oxygen is just much more effective in reversing and preventing overdoses.
It's kind of an obvious question, but how scary and dangerous is this stuff?
It's pretty terrifying, largely because we don't know much about it and we don't have a reversal drug for it. We have to begin testing why it is causing these wounds within humans. And currently, we are in a place where the only thing that stops the wounds from progressing is discontinuing use, which is not a realistic expectation to put on a community that is chemically dependent on it.
Here we have people smoking the pills right out in public. That seems to be mostly what we see. What is the attraction for users to use this xylazine and fentanyl together, to shoot it up, or even to snort it, smoke it? Not sure how else they take it.
So originally, when it was added as an adulterant to the fentanyl supply, it was added to give it legs, which means to make the high last longer. And it wasn't the main supply. Nobody that was consuming the supply at that point was aware. If you are purchasing drugs, you're at the mercy of the criminal drug market. Whatever they choose to put into the supply, you will be consuming. And it doesn't come with a warning label. So I believe that it was added as an adulterant, and because it is so easy to traffic and to get in, and there's not a lot of criminal consequences because it's not scheduled, the criminal drug market decided to continuously add it to the supply, causing the individuals using it to be chemically dependent now on xylazine. Whether they like it or not, this is now the substance they are addicted to.
So just so I'm clear, xylazine is not like ketamine. Anybody can get xylazine?
So they have added some new restrictions. However, it's an animal grade tranquilizer, so it's much easier to get. And for a very long time, you were able to go on Amazon and purchase it, which is alarming.
Yes.
And when you think about the criminal drug market, and they're always looking for something more lethal, more potent to put into the supply that's easier to traffic and distribute. This made sense, especially with COVID taking place.
Yeah. I want to just circle back. Savage Sisters, can you tell me the mission statement of that, and why Savage?
So Savage Sisters' mission is attacking addiction ferociously with radical love through connection. We do that with housing, education, and harm reduction outreaches. The name Savage Sisters came because almost 6 years ago, I was thrown out of a window in Kensington and I was almost killed. And I was homeless and addicted to substances. I was wearing a dress that said Savage. I was cut out of that dress. And when I got sober, I still had it with me. And so I started my first women's house, and I said, we'll call it Savage Sisters. because we're going to chase our recovery as ferociously as we chase our drugs.
You know, there's such a push nationwide to try to battle the fentanyl addiction. I mean, some people I think are starting to wake up. It's a huge problem here. The way the law is here, you get referrals the first time you're caught with, drugs just for possession. So there's a big debate here on whether they need to make that a felony, even though there's not treatment funded right now. What's the biggest problem right now nationwide and what you're seeing on getting help to people who don't always want it, but sometimes have to be jailed, and then they're let back on the street because maybe there aren't treatment programs? Do we need more organizations like Savage Sisters? Where are we falling short here?
I think right now we need to respond to this as a mental health problem and not criminalize it. The criminalization is wasting tax-paying dollars, and our judicial system is completely flooded with nonviolent drug offenders. I think that there needs to be an attack on stigma nationwide and a more accepting, non-judgmental space for individuals. And I also think we need to start talking about safe supply, because the reason fentanyl took over the supply is because they wanted to find something that was easier to traffic and manufacture and give people something similar to heroin. I know nobody wants to talk about that, but individuals do use drugs, and the leading killers are all legal: tobacco, sugar, and alcohol. So we need to talk about this so that we can create a safe supply. Stimulant deaths are on the rise because they're being laced with fentanyl as well. If an individual had an area where they could get a substance that they were seeking, we wouldn't have all of these fatal overdoses.
Yeah, that certainly is part of the public discussion here. I guess I looked at the video that you shared with Katie, and I see the wounds that you're treating there, and it almost looks like the flesh-eating bacteria wounds. I mean, what are you seeing among people who are using this Tranq dope, they're calling it?
They're from minor to severe. It depends on how long they've had them, and it has a lot to do with public health and their personal health as well. Do they have infections? Do they have access to showers? Some of them are just small pox, but as somebody continues to use, those are growing into open ulcers. There's skin, tissue, muscle, bone exposed. In the summertime, we see a lot of individuals that have maggots growing into their wounds. And honestly, the necrotic limbs, they're leading to amputation. We have had a 39% increase in amputations in our hospital settings in Philadelphia year over year. That's an incredible number. So we really are trying to address it as quickly as possible, but the medical world needs to respond with clinicians street side. The work that we do, that we've been doing for 3 years, is a Band-Aid on a bullet hole. They don't need a wound to be wrapped. They need IV antibiotics.
Do you think this is going to be a bigger problem on the West Coast, like what you're seeing?
100%. I've been working, there's one lab, Aegis Labs, and they do testing for xylazine, and I talk to them often. It's been found in 32 different states, and the progression of how it is entering the supply is much quicker than Philadelphia. So it took us about 2 years for it to dominate and take over our supply. Whereas in Boston, for instance, it was almost non-existent in July and August, and it is now in 70% of their supply. So it is going to come into the supply, and I think that communities need to be prepared with wound care, and they need to be prepared with urgent care in hospitals to respond to those acute withdrawal symptoms to make people comfortable so that they can deal with the treatment that they need.